Hi, Jenny. Delighted to
Hi,
have you
Gemma.
here today. We're so excited to hear what you have to say to us on this No Smoking Month, March. So, first of all, Jenny, I just want you to introduce yourself and tell us what your job role is within the Southern Trust.
Thank you so much for having me, Gemma. It's lovely to be able to come and speak to you today. My job is I am a midwifery coordinator for our perinatal mortality reviews. So first and foremost, I'm a midwife and have been for about 8 years now, and I've always worked in the Southern Trust. And more recently, I've moved into a governance role. And what my current job entails is reviewing care for babies that have sadly died through stillbirth or neonatal death. So the main part of my job is acting as a coordinator for both families and the review team. So I act as a key contact for mums and dads who have lost a baby. And what I do is talk them through the review process, explain to them how we do that. And I also work with them to gain their feedback on their care. So the care that they've received during their pregnancy, during their birth, and afterwards as well. I work with a team of doctors, midwives, and nurses. So obstetricians and neonatal doctors, senior midwives, management team, and neonatal nursing staff. And what we do as a group is that we look really in depth at all of the care that any family receives, right from the start of their pregnancy right through. And the main focus of that is identifying if there are any issues with the care where we could have improved care, and if there's any learning. So it's kind of a two-part process. One is finding answers for the families, and that's really, really important. And the other part of the process is identifying learning for ourselves. So it's really important that we look at every case really carefully and identify if there are anything that we can learn from it. It also helps us identify themes and trends and look at reasons why sadly babies do die before they're supposed to. Um, it's really beneficial to talk to families. Really, really beneficial. It's difficult and it's not an easy thing for anybody to have to do. But if you can hear about the journey that families have through our system, it helps us make things better. And then at the end of the process, I provide feedback for the families, give them answers, explain what happened as best we can. And I also then take the learning and feed it back into training for our staff. So our midwives, our doctors, and our nurses. And we look to see where we can make changes and improve care.
Brilliant. Thank you so much, Jenny, for that. So why did you agree to come on here today to talk to me and to talk to the wider audience about smoking and pregnancy?
Stop Smoking Month is a really useful time to look at all of the things that we can do to help women and families improve their health overall. Unfortunately, smoking is a very big risk factor throughout pregnancy. Smoking significantly increases the risk of pregnancy complications and a very wide range of pregnancy complications. But most significantly for the care and the work that I do is that it increases the risk of stillbirth and neonatal death. If you smoke, you're 40% higher chance of having a baby who's stillborn than a non-smoker. You're 3 times more likely to develop problems with your placenta, and you're 30% more likely to have a premature birth. Babies who are born extremely prematurely and who have growth restriction associated with placental problems caused by smoking are much more likely to die in the neonatal period than babies who don't have those associated problems and are born early. And those are kind of national figures, but more local here in our own trust. Growth restriction and problems with the placenta are linked with more than 50% of our babies who die by stillbirth or neonatal death. So it's a really significant concern. And there's a lot of work going on to try and reduce smoking throughout pregnancy, and I'm sure you're speaking to lots of different people who are involved in that work. But in 2022, 18% of our babies who were stillborn were smokers. In 2021, that was 25%. So it is still a very significant cost to families. And smoking in the household has a significant impact as well. So for lots of families, they may have pregnant mums who don't smoke, but partners smoke. And having a smoker in the household can also increase the risk to pregnant women, but also to the whole family of health complications, including during pregnancy.
Thank you for that, Jenny. And it is very interesting when you start to break it down with regard to smoking.
They're not easy numbers to hear. And one of the things that's always been linked is that, smoking causes small babies, and small babies aren't a good thing. We worry a lot about small babies, and we look we try and look after people very carefully to ensure that we can detect when babies are small. But whether or not placental factors were an issue, 80% of our babies who die unexpectedly are small babies. So and it's not easy information to hear, but there are really significant risks associated with it. And it's really important that people really carefully consider all of the things that they can do. And that's us as health professionals and families and women, all of the things that they can do to try and ensure the healthiest possible pregnancy and try and, allow room for the best possible outcomes for everybody. We can't prevent all of the things that happen and all of the sad things that happen to families, but where we can prevent it or where it can be stopped, it's really, really important that we do our best to try that.
Thank you, Jenny. So what advice would you give to somebody who's planning a pregnancy and they're currently smoking?
Well, the first thing I would probably say is that actually smoking affects your fertility. So if you really want to grow your family or you want to have your first baby, it's really, really important to think about a healthy lifestyle. It's a really big decision, and it's a really happy decision and a really positive decision. So if you can take time in that early stage of planning to think about all of the things that you can do to help make getting pregnant easier and to help maintaining a pregnancy, and going home at the end of it with a healthy baby, then it's really important to think about the effect that smoking can have. It can take time to stop smoking. So it's important to think about it early. It's not an easy thing for anybody to do. And it's really important to ask for help. Help and support from lots of different people. So I would say for a couple who are planning to have a baby, it's really important to look if either of them are a smoker to consider giving up early. And that help and support can actually increase your chances of success in stopping. Making a plan, planning a date to stop and planning how you're going to do it is really important. Thinking of pregnancy as a time to improve your overall health outcome for the rest of your life. So for a lot of people, getting pregnant and having a baby is their first real interaction with the healthcare system, maybe from, they were little, if they've no health complications. So using that opportunity, when you're around healthcare professionals, and there's lots of health promotion advice out there to improve your whole life, and family benefits in the long run. There's an increased risk of complications with any amount of smoking. So stopping is really the best thing you can do, and the best thing you can do is plan it and seek help early. There's lots of help out there, and I'm sure there'll be lots of other people talking about ways to get that help. But find your local stop smoking service. If you're already pregnant, speak to a midwife and figure out the best way to do it for you. The other thing I would say is for a lot of people, and historically, people may have said, oh, well, I've smoked before and my babies have been fine. And that's a good outcome, and that's okay. But that doesn't mean that there won't be complications in this pregnancy that can be associated with smoking. It can also increase the risk of childhood problems. It increases the risk of sudden infant death syndrome. So it really is a whole life change, and it's a positive change for everybody in your family if you can stop smoking before you get pregnant.
Thank you, Jenny. That's really beneficial for our audience today. So lastly, what advice would you give to a mummy out there who's currently struggling to quit smoking in pregnancy?
It's never too late. It's never too late to stop. Yes, it's the earlier the better. But if you think that you've already gone past the point, don't think that. There's always time. Um, Ask for help from professionals, but also your friends and family. Um, it's not uncommon that if a person smokes, that there are other people in their life who smoke, and it might be an opportunity for you to get together and do it together, as a way to help increase your success rate. Make positive changes, so you're giving up something, and that's a good thing. That's a healthy thing to do, but make positive changes with it. So if you're struggling and there's times of the day that you find it really hard, find something small that you can do in those moments. It might just be going outside for a 5-minute walk, or making yourself a cup of tea, or, popping on something on TV that you like. Whatever it is for you, small changes really make a difference. Our smoking cessation midwives work really hard with mums to help them quit. And if you engage with them, they'll help you with all of the tools that you need. If you've recently quit and are struggling, it's really important that you engage with those smoking cessation services that are out there. Nicotine replacement therapy is a really useful tool to help with any quit attempt. So it would be really helpful if you are struggling, that there may be other options for you, and you can speak to your smoking cessation midwife about that. And mostly I would say, remember why you're doing it. So you're doing it to have a healthier life for you and a healthier life for your baby. And sometimes that positive affirmation is all that you need to give you that extra little push. Take it one day at a time. One day is easier than 1 week. So start with one day and move from there. And celebrate all the little milestones that you get. So if you manage one day, celebrate that with a little treat. If you manage 1 week, celebrate that. And then at the end of it, think of all of the money that you've saved. There's lots of benefits there. Having a baby is a difficult time financially for some people. So if you can take all of that extra money that you can save from stopping smoking, it can make that transition into parenthood easier. And it may also leave room for something nice for yourself as a reward, for giving up smoking, as well as the lifetime reward that you get from better health and a healthier family life.
Jenny, thank you so much for all your advice, for your tips and your expertise with this. I really appreciate you taking time out of your busy week to come along here and chat to us today.
Thank you very much for listening. And I hope everyone has great success with their attempts and their stop smoking attempt. Thank you.